Good morning, good afternoon, and good evening to all of our participants joining from across the globe. Thank you for attending the second day of this excellent conference on a better future for essential workers, organized by the Global Deal in collaboration with the Open Society Foundation. My name is Sabina Devan, and I'm the President and Executive Director of the Just Jobs Network and a Senior Advisor to the Global Deal Initiative. It is a pleasure to be here today with you. Yesterday's panel discussions underscored the essential role of workers that range from healthcare and emergency workers to transport, domestic, gig, care workers, to workers in the global food supply chains. The worth of these workers and their many contributions, both before, during, and after a crisis such as the pandemic, unfortunately, even today remain inadequately recognized, often manifesting in poor pay, a lack of social protection, and decent working conditions. So the panels yesterday gave us examples of what governments in Scotland and the United States and Chile are doing to remedy this. We heard from trade union confederations and civil society organizations, from businesses about how the pandemic has exacerbated the challenges for these essential workers, but also what must happen. What must happen in terms of reinforcing social dialogue, freedom of association, and collective bargaining to empower essential workers. We heard about leveraging tax policies, building a social protection fund, and sector-based models for social security provision. All of these different instruments that we discussed yesterday with a range of stakeholders reinforces one key message. These workers are the backbone of economies, societies, and households, and that in turn, we must build economic systems and social systems that appropriately recognize and value the many contributions of these essential workers. And this is particularly critical in these uncertain times that we live in. So with that brief summary of the proceedings from yesterday, it is my great pleasure to welcome our first speaker, Ms. Lale Ispahani, who is the co-director of Open Society Foundation in the United States. So Lale, over to you. Thank you so much for joining us.
My pleasure. Thank you, Sabina. Look, I'm truly, truly delighted to speak at this hugely important event. The Open Society Foundation, as many of you know, deeply values the rights and needs of essential workers and their issues close to my own heart. First, let me just offer a profound thanks to our partners at the OECD, the ILO, and the Global Deal Unit for hosting this really important event, and to our partners that represent essential workers around the world who are with us today. We're really, really honored to have ministers and government officials, business leaders, and investors join in what this very, very important dialogue. So our invitation to you today is just to listen, to learn, and to take action. I grew up in Bangladesh and in Pakistan, countries with huge gaps in wealth and social status between workers and employers, who were fellow members of similar but very unequal societies. These power and wealth imbalances meant that the workers that kept us clothed, fed, and cared for were often harmed and even killed in the line of the work that they were doing. So in Pakistan, the Ali Enterprises factory fire in 2012, I'll remember, killed 250 workers. In Bangladesh, the Rana Plaza tragedy, which many of you heard about in 2013, killed over 1,100 workers. And then in the Gulf states, it's estimated that 10,000 migrant workers, mainly from Asia, die each year. These tragedies really impact mainly people who are already poor and most unprotected. So we know all these stories of hardship, but it's really important to me to not let us miss the inspiring stories of change and of what's possible. They may be fewer, but they point the way forward. And so we should, at a time like this, focus like lasers on them. So prompted by COVID, some governments came to recognize the value of essential workers. They put in place social protection benefits and wage protections. Especially during the height of the COVID-19 pandemic lockdowns, In many countries, workers organized and negotiated with employers and municipalities to secure better working conditions and safer workplaces. Where I'm beaming in from, New York State, we, together with advocates, community organizations, government agencies, and the private sector, established a fund that paid $2 billion to over 128,000 essential workers, financial relief to workers that were left out of all state and federal pandemic-related benefits otherwise. And it wasn't just government that rose to the call. Some businesses did too, protecting wages in particular. Essential workers kept our economy and society going, including care workers, domestic workers, street vendors, waste pickers, home-based workers, and all the workers delivering the vital public services that kept us, our communities, alive, connected, and functioning. So while the pandemic has shone a light on these deep inequities in our global economy, today we know too many workers remain excluded from basic rights and protections still. Informal workers, who make up more than 60% of the world's workforce and 90% of workers in developing countries, often lack trade union representation and tend to work in jobs without access to these basic social protections. Women in particular face the threats of harassment, threats of violence at home and at work. Migrant workers are often in extremely low-paid, precarious and unsafe work. Yet our economies and societies continue to function. The Open Society Foundation supported an essential workers campaign in 2020, some of you may know, to support trade unions and informal worker organizations to strengthen these alliances with one another and to build their advocacy capacity and really help increase their voice and visibility in the media. 7 organizations that are at this conference have been part of the campaign: the International Domestic Workers Federation, WeGo, HomeNet, StreetNet, ITUC, UniGlobal Union, the Solidarity Center, as well as Public Services International. And we've worked together over the past 18 months to focus attention on 4 key issues that have framed this conference, and sharing stories of collective action for change around each. So fair income and better working conditions, social protections, especially for those most vulnerable, health and safety at work, and an end to violence and harassment at work. So you might ask, what's the role of a philanthropy here? Well, it probably varies foundation to foundation, but Open Society for itself has committed resources, a range of resources, those that we have at our disposal, financial, advocacy, convening resources, all in service of stronger rights, protections, and bargaining power for our partners, for our essential worker partners everywhere. So like many of you, we want to emerge from this pandemic with something different and better, with a more inclusive and equitable global economic model, one that recognizes the rights of all workers to organize collectively and to advocate for better terms and conditions of work. It just shouldn't be this hard. We want to see fairer resource distribution by governments for social protection. We want to see greater corporate accountability and due diligence in preventing human rights violations that result from their commercial operations. And above all, we want to see a world in which we treat one another with equity and justice, which are, and if they aren't, they should be, hallmarks of democracy, and they certainly are of open society. Thank you.
Wonderful. Thank you so much, Lele, for those very inspiring remarks. And I think, you know, the mention that you started your remarks with saying that in these very uncertain and difficult times that we have to hold on to inspiring stories of change. And I think yesterday's conversation that addressed fair pay, social protection, and decent working conditions really brought out both the challenges, but also these kinds of inspiring stories for change that we want to hold on to, and hopefully hear more of them today so that we can think through how to apply these models, how to embrace these models, and how to sustain these models that lead to better outcomes for essential workers. So today's conversation in particular focuses on improving occupational safety and health. And we know that many essential workers face forms of occupational safety and health risks in their different forms of occupational safety and health risks in their professions. And the most recent and perhaps visible example of this are the health and emergency essential workers that were at the front line of the pandemic that continue to work in close proximity with others despite the risk of exposing themselves to the virus. This panel, that I look forward to introducing, will demonstrate how social dialogue can make a difference by providing essential workers with better protections at work. So it is my pleasure now to introduce our esteemed panelists for this session, Mr. Matthias Landgren, who's the State Secretary to the Minister for Housing and Deputy Minister for Employment in Sweden. Welcome.
Thank you so much.
Ms. Heani Ramonan, who's the Director General for Labor Inspection and OSH Development, Ministry of Manpower in Indonesia. Ms. Elke Bossiger, who's the Deputy General Secretary of the UNI Global Union. And Remy Boyer, who's the Chief Human Resources Officer and Corporate Social Responsibility at Corian. So thank you so much for being here. Matthias, if I may start with you, and if you could just tell us a little bit about the measures that you took in the pandemic to minimize the risk of infection for frontline workers, and what role did social partners play in this?
Well, thank you so much, Sabina, and I would like to also convey my thanks to OECD, the Global Deal, and the organizers for putting on this very important conference. And I think the topic is just spot on. Perfect opening remarks by Lade. I thank you so much for your inspiring words as well. And well, the pandemic has had a major impact on the world of work, and the work environment has changed for everyone in one way and another. Basically almost overnight, not really, but almost. And essential workers have had to go to work as usual to keep the basic function of the society running, which has made them more vulnerable to catching the virus. And for healthcare and care workers, the pandemic has meant long working days and heavy workload with sometimes very limited time for recovery. And the essential workers have had in many ways been the frontline heroes in our society in the era of COVID. And for that, I'm so truly thankful. Well, let me just start out with just talking about the social dialogue that we have had here in Sweden. And in time of crisis, social dialogue plays a key role in absorbing shocks and navigating the new reality. And Sweden has a very strong and successful labor market model, a very strong dialogue between the state and the labor market social partners, and how policy can develop and initiatives that ought to be carried out is important part of a successful working life policy. And this tripart cooperation is also an important starting point for continued work to ensure a good work environment in the Swedish workplaces. The Swedish work environment legislation is based on the employer being responsible for the work environment. And while working in collaboration, very close collaboration with the trade unions, employees and safety representatives to improve it. That's the core of our Swedish model that we are sometimes very proud of to say. And there is a very long tradition of the labor market social partners working really together on joint health and safety measures. And throughout the pandemic, the Swedish government and the Minister of Employment have had a close and continuous dialogue with the social partners in order to hear what's on the agenda, what's on top of their agenda, and what is the issues right here and now. And there have been several meetings between the social partners. For example, with the social partners within the healthcare service, the Swedish government and the Swedish Work Environment Authority on the matter of occupational health and safety on the specific challenge with arose during the pandemic. And the social dialogue provided the Minister of Employment an accurate description of the situation and what was possible measures that could be taken or to improve the work environment for essential workers. The government have been able to meet and remedy several of the suggested measures that have been brought up during the social dialogue with the social partners. We have been listening to the expert, the academia, and will continue to do so. That is the core of this tripart Swedish model. And measures during the pandemic. We'll now present some of the measures that the government took during the pandemic. Firstly, the government acted quickly upon the EU recommendation regarding personal protective equipment in order to meet the unusual high demand in order to ensure a safe work environment for essential workers. The initiative consisted, for example, on a fast track to approve personal protective equipment that is safe. Secondly, the government focused on spreading information on a systematic work environment, and especially concerning the risk within the organized and social work environment during the pandemic. And thirdly, several measures in the Ministry of Health and Social Affairs policy area have been taken in order to reduce the spread of the virus and relieve the essential workers within the healthcare sector. And for example, compensation to people who belong to a risk group and relatives to risk groups, compensation for qualifying period of deferred requirements for medical certificates. And further, the government has considerably raised its ambition as regards to work and life, which, for example, has been demonstrated through the government's work environment strategy. The government strategy focused on 4 priority areas, and there are 2 focus on occupational health and safety. Health, working life should contribute to developing and well-being and safe working life, that no one should risk their life or health because of the job. To just sum it up, our main message here is that we need to have strong employers organizations, strong trade unions, in order to make them strong on both sides. We will also have a very fruitful social dialogue, and crisis like the pandemic is a very good way to have the social dialogue, that we can see what we need to do from the government perspective, and also what the social partners has to take for kind of measures. So that is the Swedish model in a nutshell, and there is, of course, room for improvement, but I'm quite proud to say that I think this helped us quite a lot during the pandemic. Thank you so much, Sabina.
Thank you so much, Matthias. I think you raised several very important points, and I think a couple of things that really stood out for me is, one, the fact that often governments deal with these issues that are interconnected in siloed ways. So the fact that there was, employment with health conversing in Sweden, I think that makes a huge difference in terms of the kinds of outcomes that we're able to bring about for essential workers. And in addition to that, I think, hearing the Swedish experience about the centrality of social dialogue, when work is such a central part of people's lives, that having safety at work is so important, because it's such an important part of the population's lives, and leveraging social dialogue to promote good conditions is important for all workers. With the Swedish experience, now I'd like to actually look at the experience in some of the global South countries. And for this, Hayani, if I may turn to you and see how you could tell us a little bit about the experiences from Indonesia on how to improve workplace safety during the pandemic. How is ensuring safer workplaces good for both workers and businesses? What has the Indonesian experience been? Hayani, over to you.
Thank you, Sabina, and also thank you for inviting us in this conference. I think this is very important forum. So I think all we know that since WHO officially declared COVID-19 as a global pandemic, and its spread continued to increase all over the world, including in Indonesia. The employment sector is, of course, one of the sectors affected by the pandemic. There are disruptions of activities in the world of work from every side, including tripartite itself, employers and also employee, and also the government side. I think with dealing with these conditions, the government of Indonesia has responded proactively with various policies and programs, with a focus on strengthening labor protections and supporting business continuity in the face of a pandemic. Various activities are carried out together with stakeholders, of course. I think the social partner is very important. Also, ILO, Employers Association, Trade Union, Employment Social Security Board in Indonesia, University, OSH practitioners, and other OSH associations, including in policy formulation, as well as in the raising awareness and implementations on the prevention and control of COVID-19. The Ministry of Manpower of Indonesia, in our office, also carries out a number of programs such as distributions of masks, personal protective equipment, hand sanitizers, face shields, and portable and washing facilities to companies, and many others programs. And also the establishment of Corona OSH Comment Center, which is a channel for informations and complaints on the labor norms related to the pandemic. There is also programs, free COVID-19 testing in Indonesia, like a PCR and antigen for more than thousands companies. Facilitate vaccination programs and also encourage for vaccination programs for all eligible workers and many other programs. And to maintain business activities during the pandemic, enterprises encouraged to develop business continuity plan, which is done by 7 steps, which intended to maintain all existing businesses resources in order to support essential activities. And I think this is very important, since I would like to emphasize that it is very important the involvement of workers and trade union in each of these steps, which is very essential, since the program is actually about the workers. Of course, but also about the company. But the most important asset in the company is also workers. For that, workers must be actively involved in the program through the OSH committee. We have the OSH committee in Indonesia. Since 1987, Indonesia required companies with more than 100 employees or companies with a high risk level to form OSH committee. This is compulsory, actually, whose members are representative of employers and workers. The OSH committee has a function as a forum for cooperation between employers and also workers to develop mutual understanding and effective participation in the implementation of OSH. This has made the OSH committee as the important key of the prevention and control program in the workplace in terms of COVID-19. We did a survey, and the result of the survey we conducted in 2021 in 21 provinces of 34 provinces in Indonesia, with 703 companies. It was found that 95.3% of companies already have an OSH committee, and of that number, more than 80% of them are carrying out prevention and control program properly in terms of COVID-19. This shows that the OSH committee has a major role in ensuring the successful of programs to prevent and control COVID-19 in the enterprises. I think the OS committee is indicated that there are social dialogue in the workplace. And of course, this is very important also about the result, the survey. We do a meeting led by my minister. The meeting led by minister comprised of, I think is 1,000 OS committee from the whole of Indonesia. Then we discuss about the how to tackle the pandemic. I think this is my explanations. Thank you very much.
Thank you so much, Hayani. I think, you know, OSH is essential for all workers all over the world. In the global south, we have an additional pressure of large and growing youth populations. And if we really want to harness their productive potential, we need to ensure that we have good occupational safety and health standards, and that we value the potential of our large and growing youth populations. So in that vein, having governments that are nurturing of these kinds of OSH committees that you were just talking about, I think is absolutely critical. And on that note, I wanted to actually bring in Alke from the Uni Global Union. Alke, you know, workers in food retail and care have really been at the front line. I mean, when we think of the pandemic response, a lot of people think of healthcare workers, you know, or emergency workers, but there is this wider reality of other forms of care workers, domestic workers, food retail workers that have also been at the forefront. Can you provide a couple of good practice examples of how the Uni Global Union has stepped up to protect these these kinds of frontline workers from unsafe working conditions? And the risk of getting infected themselves.
Thanks, Sabina, for this introduction and for your question. And thank you to the Global Deal for inviting us to be part of this panel. Now, let me start by acknowledging that the COVID-19 pandemic has had really a lasting impact across the entire services sector which UNI is representing. And it really has brought occupational safety and health to the forefront in the global conversation about workers' rights in general. And I believe we've all seen the important role that unions can play to keep workers safe. And I believe we have strong evidence that we've seen that without the trade unions, the pandemic would have been even more deadly, and that working conditions would have been less safe, and essential workers would not have the dignity or fair pay that they deserved for the work that they did out there, keeping the economy, keeping all of us going. Now, UNI and our affiliated unions around the world, we negotiated better access to PPEs, time off to get paid sick leave, quarantine leave. We negotiated recognition for the essential role that some of these workers played. And there are many other gains that unions negotiated. But Sabina, you asked me to focus on the care and commerce workers who've been really on the front line in the pandemic and their essential roles. So I'd like to highlight a few examples of how UNI and our unions have stepped up to protect and support retail and care workers. And I'll start with the guidelines that both our sector unions, UniCare and UniCommerce, issued at the beginning of last year to keep workers safe. In the care sector, what we saw during the crisis was that nursing home residents had the highest death rates in many countries. And that also meant that long-term care work itself became one of the most dangerous jobs. And I'm sure Remy is going to speak more about that, what Korean has been doing to keep workers safe in their company. And the guidelines that UNI issued, they were really meant to support our national and the local unions to negotiate with employers immediate measures to keep both the staff and the residents in these care homes as safe as possible. And those demands included things like proper PPE. We heard stories of, at the beginning, of staff having to share protective gear, access to COVID vaccines as a priority, free COVID testing, the provision of infectious disease training for care home workers so that they could protect themselves and the patients that they cared for. And very importantly, paid time off for those care workers when they got sick. So they didn't make the patients in the care home sick. The situation was also bad, but of course, in the grocery stores, where the workers remained on the front lines throughout the pandemic to provide us with food. And it was our goal with the guidelines that we issued to protect both the workers and the customers. And my colleagues in Unicommerce, they signed a joint declaration with 6 leading multinational food retailers from France and from Spain, who jointly represent a global workforce of 1 million workers. And in ratifying this joint declaration, these food retailers committed to working closely with the local unions and with UNI on measures to control the risks of COVID-19 in the workplace. And I think what's also worth noting is that this joint declaration was also important in establishing a social dialogue with some of the companies which we didn't have a close relationship with before, where we don't have a global framework agreements like we have with some other companies. And in addition, these guidelines that were issued by Unicommerce and Unicare, they also led to some legislative initiatives in a number of countries. Let's look at Japan, for instance, where the government issued policies to better protect essential workers, or in Argentina, where the government is currently considering a law to make health and safety committees mandatory in all workplaces. Now, this kind of rounds up my summary on the guidelines, but I'd like to add a couple more brief examples if you allow me, Sabina. I spoke about care homes, but I'd like to switch over to home care workers, because in New Zealand, home care workers, for instance, were initially not included in the supplies of PPEs for healthcare workers. They were simply forgotten. But as we can all imagine, home care workers that go to the homes of these highly vulnerable people, they risk spreading the virus not only to their clients, but also to the families of the clients, but to their own families at home. So our union in New Zealand, they joined together with community organizations, and together they achieved that the supply of PPEs was also extended to home care workers. In addition to that, they also negotiated paid sick leave for those home care workers. Or as another example, in the US, our affiliate, the UFCW, in the retail sector, they negotiated hazard pay that recognized the important role that food retail workers played during the pandemic. And they also negotiated provisions for paid breaks to wash their hands, for paid leave for workers that had to isolate because they got infected, or financial assistance for childcare costs because the schools were closed for such a long time. Now, with the support from Open Society, and I would like to thank Open Society for the excellent cooperation that we've developed with them, we've just released a new report last week, which is entitled Safer Jobs and Stronger Unions. And that report gives many more examples of how unions and employers have worked together, but also how unions have stepped up during the pandemic to protect workers. So if you want to see more of these great examples, just go on our website and check out the report. And I'll leave it at that for now.
Thank you so much, Olke. I mean, I think, you know, in these very uncertain times of growing precarity, the centrality of unions and developing mechanisms like social dialogue becomes ever more important. And the pandemic has only reinforced that. This crisis has only reinforced that. And you know, and as we look to other kinds of restructuring with climate change and other global transformations, I think keeping that in mind and strengthening the union movement is fundamental. The other side of that is, of course, businesses. And, you know, so now I would love to bring in Remy Boyer. Remy, let me ask you, you know, taking care of those who provide care is one of your company's criteria for sustainable performance. So can you elaborate a little bit on what Korean, together with workers' representatives, what they did to, you know, to take care of workers, and can you sort of testify to this commitment?
Thank you very much, Sabina. Good afternoon, everyone. I'm really honored and pleased to participate to this panel, and thank you very much to Global Deal, and also to be happy to share my experience as a business practitioner, I would say, in this roundtable with ministers, OECD, ILO, Global Deal, and UNI, of course, who is a partner from Korea. I would like to, in fact, my intervention today has been seen as a kind of speech on behalf of essential workers, because I am okay, I'm the head of HR and CSR, but I'm here because of these people. And sometimes these people are called the first line, or sometimes the back office of the society, to quote one French sociologist who just wrote a book on the so-called invisible people of the society. So this is the topic I would like to discuss. And your question is how much the essential workers of Corian has been hit and impacted by this sudden pandemic that nobody was prepared to. And you are fully right when you say the essence of the employer promise is to take care of those who take care in a kind of a symmetry of attention and reciprocity. And this is a very good formula that I will keep for me. So I will deal with two topics. The first is what, as a business company, we put in place to react in front of these pandemics. And second, does this pandemic really change the situation for the future? And I saw it was one of the questions of the chat. So let me just remind you, with Corian, we are a European company present in 7 countries with 60,000 essential workers across the countries. And 60% of these 60,000 are caregivers. And 82% of the workforce are women. And it was mentioned before me. And just be aware that 1/3 of these women are single mothers with facing very difficult life situations. So this population was accustomed before the pandemics to deal with epidemics or such as flu, for instance. So it was not really new for them. What was new was the devastating and sudden crisis we all have to face in some days. And to be honest, nobody was really prepared, either governments or business companies, to such a sudden crisis. We had some early signals from Asia, of course, from China, but nothing to do with what came in Europe. And the first phase was to get organized. And for that, we had to work with the works councils and the unions representatives. So for the very first days of the crisis, end of Feb, beginning of March 2020, we had to organize ourselves, to put it really modestly, to set up crisis cells, to be organized on site, to anticipate some decisions that the governments took after us, such as lockdown of some sites, all sites, to provision some stocks of personal equipment, protection equipment, finding where these stocks were and providing the stocks to the people directly. So it was 2 weeks of highly intensive organization in which we immediately associated the Works Council in all countries. And I think since the beginning, we realized with the Works Council that they were essential to report to us the facts from the shop floor, and especially the shortcomings observed on the field. And then during the first phase of the crisis in spring 2020, just one figure, in France, we organized 38 central Works Councils, while usually we have one per month maximum. So meaning that every week we had this central Works Council meeting on essential topics for essential workers. Then in phase 2, after the summer 2020, we realized that not only the PPE were needed, but the psychological support was needed. Because this is the kind of thing you don't see immediately. But it was very well said before me by the panelists. The psychological support is essential, because these people who take care of others, usually they don't dare to say, or they don't want to say, that they suffer from themselves from this, because they are really so passionate and so engaged in their job that they want to take care first of others before taking care of themselves. So this was the second phase, and we organized some psychological support, such as work group of in the site to speak, to express, not to keep for themselves what they felt. And last year in 2020, we had also a survey to all employees just to check what they felt about the way the company was supporting them or not. And I think it was an interesting result that I could share afterwards. And And during the whole process, unions and works councils played an absolutely pivotal role. And they were involved in all decision taking, such as, for instance, the corona premium that were mentioned by Mr. Landgren, or the vaccination campaign, how to prepare them, how to reduce the risk and the stress of vaccination for people who were not mandatorily accustomed to vaccinations, or the big topic of absenteeism and replacement of these people who were sick and ill. And during this time, we set up the first European Works Council of Corian in June 2020. And we did not hesitate at all to set it up, because this European Works Council was instrumental to circulate good practices and to reduce the stress of workers in front of these pandemics and all the measures that we had to take. And for instance, just a quick example, we organized every quarter a conf call with the head of medical, the medical doctor of the company, with the bureau of the European Works Council, to answer all questions from the workers, including the most simple question to reduce stress on the field. Then, in the second phase, after managing the crisis, what did we learn from the crisis, and what did it change for us? I think one lesson learned is really that the health and safety at work came up as one of the most important topics for our business company, and I'm sure that the COVID crisis accelerated a lot the utmost importance of occupational health and safety within the care sector. And I just wanted to mention some very good reports that were issued by the OECD, for instance, on long-term care workers. Who cares is the name of the report. And this report is amazingly full of data and learning. And one of the big learning in that is that the occupational health and safety in our sector is weak. Right. So I think COVID put that again under the spotlight, and I think it's very good for our sector. And we saw a lot of reports from the governments. I can only quote Mrs. El Khomri in France, the former Minister of Labor, who issued a very important report in 2019 on how to improve the sector on this point of view. So to conclude, I would say we were massively confronted to the first phases of the crisis, and we had to set up the good governance with unions and Works Council to address together the pandemics. And second, I think we learned a lot from these pandemics while putting again as a very important priority this occupational health and safety for workers, with safety agreements signed with the unions, with the European Works Council. And for sure, in the future, it will become, I will not say the first priority, because the first priority for us is to find staff. But if we don't guarantee that they find at Corian or in the sector the good working conditions, including health and safety at work, they will not come to the sector. So it's at the same time a CSR commitment and a business matter.
Yes, thank you for that, Remy. Excuse me. I think that what we're hearing from a number of different panelists is how in non-crisis times, establishing traditions of work councils that helped instigate quick action as this unprecedented crisis emerged, or having the OSH committees, or having instruments for dialogue, how in non-crisis times we have to build these institutions so that we are ready for when an unprecedented situation strikes. And so Hayani, I'd actually like to bring you back into the conversation. And as always, the time is too short. So if I may request just a couple of minutes, but we have a question from the audience about, how do you extend occupational and safety and health to workers in non-traditional workplaces in the informal economy? So a lot of these mechanisms that we've been hearing about are tied to employment in formal sector. And we'd love to hear from you about extending this to the informal sector. How does that work? Just a couple of minutes, please, if you could unmute yourself. Thank you.
Yes, thank you very much. I think Indonesia has an act and has a law on work safety, in which it stated that employers are obliged to communicate those requirements to workers so that they are aware of this. Workers have the right to ensure that they are guaranteed the safety and health of their work in carrying out their work. If the workers feels ensured that he or she has the right not to do his job, for these agreements, it can be clearly seen that OSH requires dialogue between both sides, both parties, and also our law applies apply to all sectors. So regardless other workers, all sectors in the mandatory category to have OSH committee. It doesn't eliminate their obligations to continue to implement OSH. So the government, through labor inspection, certainly has a different approach between companies that are categorized as a large or have high risk and SMEs. The approach to SMEs or small, maybe small and micro company is more focused on fulfilling the implementation of OS requirement through development efforts. Meanwhile, in the large and high-risk company, there are stronger law enforcement effort because they have a different characteristic from SMEs. The point is that the implementation of OS in general requires a good and conducive social dialogue. I think for specific non-traditional economy, something like that, we have to do massive socializations, which is come through, of course, government and also both party, even in trade union, for example, and also companies except or employers. I think that's my explanation. Thank you.
Thank you very much, Hani. Matthias, if I could turn to you, we've been hearing about all of these mechanisms, and now we've also heard about their extension to the informal sector. My question to you is, how do you think that these ensuing changes will be lasting? And how do we make sure that they're lasting? That we actually build these institutions in times of non-crisis and then these changes actually carry through?
Well, thank you so much, Sabina, for a very good question. And thank you so much for all the remarks. I've been listening very eagerly to hear what everybody has to say. And I think in a nutshell, what we have heard here is the key in order to continue to have this social dialogue and this work council like Remy has told about, because we can see that this is actually very good for business also, that to establish this kind of social dialogue, the work council, meaning what Alke described, all the knowledge that they would collect worldwide. I mean, that is something that we all need. And also, if we use it correctly, it will be such an advantage for that company or for that sector. As Remy also pointed out, it's very essential to have good working conditions in order to maintain the workforce here. So I think I would really like to underline the importance of not only existence of social dialogue, but also dialogue of quality in here. And I think this is something that is maturing more and more and more, and we can see all the advantages from that. And if you strengthen the social dialogue, you will also strengthen the commitment for all the workers and employers in order to create these good jobs that everybody wants and needs. So I think this is to see something good from this pandemic. I would like to always to be an optimist, and what we bring here, except for the digitalization revolution here, we can also benefit from each other and see what this social dialogue can really do and make a real difference. And in order to act swiftly here, because as we learn from this pandemic, swiftly here is something that is key. And in order also to act swiftly, you need also to act correctly as much as possible, as and in order to do that, you need this to build up this kind of dialogues. So when the next crisis, whatever that will be, you have these basic institutions already up and running, so we don't need to invent something new. So I think really the good thing about this crisis is that we will establish this kind of social dialogue, the work council, to be even more committed. So that's the positive of it.
Thank you, Matthias. And I think, you mentioned kind of in passing the digital revolution. And Elke, I wanted to ask you, in light of these kind of changing circumstances, the pandemic now, the digital revolution, climate change, all of these different kinds of, transformations that are upending employment models as we know them, employment relationships as we know them. How do we take some of these mechanisms that are in place and make sure that they're lasting in the long term and adaptable to these different situations?
I mean, so what we've really seen is during the pandemic is that workplaces that had no union, that the workers had no voice on the job, but there was no health and safety committee, they were much less safe during this pandemic. So I think the conclusion that Matthias and Remy have both drawn, which is that workers and employers need to work together for the better of the company and of workers, is the conclusion that we should all take with us. And I think the approach that Korea has taken, the European Works Council agreement that they have negotiated, is something that we would encourage every employer to do, to replicate this kind of example and really bring workers to the table, have their voice heard in negotiations around bringing about lasting change and ensuring decent working conditions. And what we've also seen is that the pandemic really has massively accelerated digitalization in the world of work. And that was one of the questions in the chat there. We've seen technological shifts occur over those last 2 or 3 years, much more rapidly than they were anticipated previously, compressing, some say, 10 years of change into just 2 years. And what's important from our point of view, again, is just like on health and safety issues here, is we need, as unions and employers, work together to make sure that everybody can benefit from the opportunities that these changes provide workers with and companies. But at the same time, we have to make sure that nobody loses out. So for us, for instance, one of the core values that we want to promote is that the geographic location of work should not alter the fundamental relationship between employer and employee. So remote working should not mean that now the worker is no longer covered by a collective agreement or no longer has the same rights to occupational health and safety or proper management or the right to disconnect. So I think it's important that the rights that people have when they work in a fixed workplace are extended to those that are working in more flexible forms of work now.
Thank you so much, Elke. I wish we had a lot more time because, we do a lot of work on gig workers, and that's, these new non-standard forms of work that are emerging and how you regulate them as part of the essential workers landscape is a whole other question. But Lale, if I could just bring you in very quickly into the conversation, I'd love to kind of hear your, 1 or 2 minute quickly response on what you've been hearing and the extension of these kinds of institutions and mechanisms, social dialogue, OSH committees, work councils, to other kinds of workers and long-lasting change as these transformations like technology and climate change, et cetera, take place. What are your thoughts on that?
I mean, just my very broad thoughts, because I've been digesting it all, and it's really exciting actually, because you see the campaigns for unionization, you see the sort of one-time activity, but it is true that if there's no infrastructure that can survive that, there's nothing you leave on the field after you build, the campaign. Sometimes you build these things into campaigns, but then the campaigns dissipate and you really no one's paying attention to what survives and what could be really useful of what survives for other workers, for other times, and provide this continuous base from which to build and from which other opportunities can be more easily seized when they come up. So I'm very much a believer in sort of building these kinds of infrastructure very intentionally as you see short-term opportunities, as we are doing right now in the US on unionization with Amazon most prominently, but other sectors as well. So it's an interesting, because I'm going into a conversation later today on those issues on the more domestic side, and I'm reflecting on all of these things I've heard from, I've been hearing and thinking, where's our long-term infrastructural thinking?
Yeah.
Are we there? What do we have here? So I'm very excited and energized by the ideas all of you have put on the table, from Matthias to Hayani to Alke and Remy. So I really, really appreciate it. And you'll sophisticate the thinking here in the US immeasurably. And I hope we can offer the same to you.
Thank you. Remy, very, very quickly, I would like just one thing that you think companies should do to emulate or to take a lesson from your company and how you've handled this. Just very quickly, please, because we have 30
Very
seconds.
quickly, I really believe that we are facing a demographic transition, such as climate transition. And then we need to better work with partners, including the governments, because we are a regulated business. So the more we will work with partners, the governments, the unions, Work Council, the best we will improve the life of our employees and at the end of our residents.
Wonderful. Well, thank you so much for that. That was short, sweet, and very clear, Remy. So, with that, I'm not going to try to summarize the very rich conversation and insights that were brought out in this panel. So with my note of gratitude, Matthias, Hayani, Remy, Alke, Lele, thank you so much for, everything that you brought in this conversation today. And we look forward to continuing this discourse on this very important topic. Thank you.
Thank you.
Thank you.
Bye-bye.
Thanks, everybody.
Thank you very much.